Okay, today we are going to have a class on discussion about albumin, which is a very important protein in our body, and this protein, albumin, is one of the most important albumin in the body. It is the most abundant in our body, and this one it exists in the body. Albumin exists in the body together with globulin. So the protein in our body contains albumin and globulin. And globulin, that means albumin is the richest. It's more abundant than globulin in our body. Now, albumin has two main functions in the body. The functions of albumin in the body is number one, it is to maintain oncotic pressure, oncotic, oncotic pressure in our body. That is the pressures in between the fluids between the blood vessels, the tissues, and also the cells. So it maintains the pressures in between the tissues, the cells, and the blood vessels in our body. That is one of the major functions of albumin in our body. The other functions of the albumin in our body is it acts as a transport. It acts as transport, and one of the main things it transports things like drugs in our body, it transports things like hormones in our body, and also it transports things like calcium, it transports things like hemoglobin, things like magnesium, and also waste product, for example, bilirubin. So those are the main functions of the albumin in our body. Now, albumin is synthesized in the liver. It is synthesized in the liver, and sometimes low levels of albumin in the body is as a result of inadequate intake of albumin. Or inadequate production. Either the low, when somebody is having low albumin in the body, one thing can be either there is low intake. Number two, inadequate production, and number three, in excess loss. Those are the three cases where you can have raw albumin in our body. So, albumin levels are very important in our body. When we measure the albumin levels in our body, now they are very important because they tell us the chronicity of a disease or the chronicity of deficit. So, when you are calculating albumin levels, it plays a big role in chronicity than in acute short-term deficit. In acute short-term deficit. So, in the body, it's not supposed to be less than 3.4 3.4 grams per deciliter. So they never be less than this one in our body. So they never be less than 3.4 grams in our body. Okay, so never be less than this one. And this one, the calculation is this one is very important because the calculation of albumin is very important because it tells us the future of mortality. It tells the future of mortality of albumin in our body. Good. So let us have some more discussion about this albumin. Now, albumin is excreted. Excretion of albumin is either excess in urine, is excreted in urine, okay, is excreted in urine, and if it is excess in urine, if there is a lot of albumin in urine, it is because of either renal disease, renal damage. In cases of renal damage, that is the time you have a lot of albumin in urine. Albumin in urine, okay, in renal damage where the functions of the renal is reduced. For example, it is very common in nephrotic syndrome. It's very common in nephrotic syndrome. It's very common in nephrotic syndrome, and also it is very common in preeclampsia. In preeclampsia, it is very common in preeclampsia eclampsia, and also eclampsia. So those are the cases where you get excess urine containing a lot of albumin, either nephrotic syndrome, preeclampsia, and also eclampsia. Okay, so when you are taking the specimen of albumin, when taking the specimen of albumin, it is affected by the posture. It is affected by the posture. Is affected by the posture. So when somebody is upright, when somebody is standing upright, the albumin can be higher than somebody when the specimen is corrected when somebody is lying flat in spine position. So whenever you are correcting the specimen of albumin, you have to know the position of your patient. The patient the patient. So ideally, the patient should be in a spine position so that you cannot have a false result of albumin. That means it does not give you false increased amount of albumin. Okay, now sometimes you have to calculate the ratio of albumin and globulin. And now you have to calculate the ratio of albumin and globulin. The ratio of globulin and albumin is very important because it tells you the chronicity of the disease and also can predict the mortality of that disease. So it is very, very important to see this one calculation. Now let us take a very good example. A patient with 7 grams per deciliter of total protein okay, and then this patient has 4 grams of per deciliter of albumin. So, how do you calculate this one? So, the calculation is very simple. The calculation is it is 4 divided by 7. 7 minus 4. 7 minus 4. Well, okay. 7 by 4 minus 4, which gives you what? Which gives you a very simple mathematics, and that is 4 over 3. That is 4 over 3, which gives you what? 1.33, which gives you 1.33. So this case that the calculation of this one is that albumin divided by globulin, and that means since the total protein is made of globulin and globulin, you make subtraction like this one, then you get the total, the ratio of albumin, which is 1.33, and it is very significant. Now, in the other way around, if the albumin is less than 1, where that there is excess, the albumin where the globulin exceeds the globulin exceeds albumin, that one is very clinically significant. Means this person is having less albumin when the globulin is the patient is having excess globulin in the body. Good. Now let us see the indications of calculation. The calculation of these globulin. To what point do we calculate indications? Indications of calculation of ratio of albumin versus globulin in our body. It is very important in assessment of chronic diseases. Chronic diseases, chronic diseases, also in assessment of nutrition status. Assessment of nutritional status, especially in geriatric patient. In geriatric patient, it is very important if you calculate that one. So also it is very important in evaluating liver diseases. That is the 3 cases, most cases where we calculate this albumin and globulin ratio. Number 1, in chronic diseases, and also in nutritional status, especially in geriatric and also in liver diseases. So, what are the potential diagnoses of these potential diagnosis of these globulin? So, diagnosis of this globulin is very important. Okay, is very important. For example, when do we have excess? At what point do we have increased globulin? We have increased albumin, especially if the patient is given excess albumin, and that is hyperinfusion. It's called hyperinfusion of what? Hyperinfusion of albumin. Albumin. That is the time you see excess what albumin in the body. Sometimes you may have to give albumin in patients who have renal failure or who have a liver failure. In that case, you can give excess albumin, and that time the patient will have excess albumin. So other cases is dehydration. Other cases is dehydration. Other cases is dehydration. And this one in dehydration, when you do a full hemogram, you will see that HB hemoglobin is high, and also hematocrit is increased. Also, hematocrit is increased. If HB is high, patient is dehydrated, HB is high, hematocrit, most likely even the albumin will be increased in this type of patient who are dehydrated. Okay, so in other cases where we have excess albumin in our body is when there is a problem in fluid concentration, the fluid concentration in decreased intravascular, in decreased intravascular fluids in decreased intravascular fluids. Also, that is when we have high levels of albumin in our body. So let us see cases where we have low albumin. At what point do we have low albumin in our body? At what point do we have albumin in our body? Number one, insufficient uptake, insufficient intake, insufficient intake, like you are not taking food with albumin is very important. This one is very common in malabsorption. Is very common in malabsorption because of poor absorption of amino acids which make albumin in our body. They are the most important in synthesis of this albumin in the body. So insufficient intake is very important. The other one is malnutrition. Okay, so this one is poor absorption in our body. The other one is malnutrition. Malnutrition in our body can make us have a low albumin in our body. For example, if it is not enough in diet, for example, if it is not in diet, okay, and if it is not in diet, and also the another case is if the liver is not able to synthesize. The liver is unable to synthesize enough albumin in our body, can result to this one. And the cases where the liver is unable to process enough albumin in our body is, for example, in chronic alcoholism, or a patient with hepatitis, or a patient with liver cirrhosis will have low albumin. Even sometimes patients who have hepatocellular carcinoma, they can even have this type of problem, or patients who have a distraction of the liver because of if a larger part of the liver is having a liver amoebic liver abscess, or even worms can make this one have a problem. So that is the case when the liver is producing or unable to synthesize enough albumin in the body. Another case where we have a low albumin is because of genetic makeup, genetic makeup, especially if the body is unable to synthesize enough albumin because of an aluminemia. It's called aluminemia. That is when the body is unable to synthesize, and it is genetically determined. Okay. Now, in some cases, in chronic diseases and also in inflammation diseases, we can have cases of diseases where the inflammation processes where we have a problem with the low albumin in our body in cases of chronic conditions are very common things like severe skin diseases, severe skin diseases. Okay, skin diseases, that is dermatology, that is in inflammation conditions which make somebody to have less albumin in the body is what? Skin diseases, even rheumatic disease, even rheumatic disease, also can make you have less albumin in your body, or even some cases of prolonged immobilizations. Prolonged Prolonged immobilization, and this one is very common in orthopedic department where the patient are put in bed for a long time. In other cases, patients with peptic ulcer disease also have a problem of oral abdomen. For example, also other patients with parasitic infections also have this problem of what? Okay, infections and infestations of parasite can make somebody have low albumin. Other cases is, as we talked earlier on, about neoplasm. Neoplasm, for example, hepatocellular carcinoma is a very common cause of low albumin in the body. It's a very common low albumin in the body. So also we have other conditions, we call them monoclonal conditions. Monoclonal conditions, we call them monoclonal and gamma pallies. These conditions, we call them monoclonal gammopathies. For example, multiple myeloma. An example is multiple myeloma. Myeloma is one of it. Another example of monoclonal gammopathies, which can cause things like Walden's strong disease, Walden and Strong's disease is also a very common condition which can result to this one. Even in bacterial infections can also to this one. Bacterial infections, and also in cases amyloidosis also can result as a way of chronic conditions or inflammation, which can result to reduced amount of albumin in our body. So sometimes albumin also can have some uses where we have other issues. That is now inflammation condition. We have already talked about inflammation conditions in summary, which can make somebody to have less albumin in the body. Severe skin diseases, rheumatoid diseases, prolonged immobilizations, peptic ulcer disease, parasitic infections and infestations, neoplasm like hepatocellular carcinoma, monoclonal gammopathies like multiple myeloma and Wilson's disease, bacterial infections, and amyloid diseases. Now, at this point now, let us look another cause of albumin and diseases in where people can have less albumin in the body, and this is when there is what? When there is increased loss of a body surface. Sometimes you can lose albumin. Sometimes you can lose albumin because of increased loss of our body surfaces. So increased over body surfaces, which can make you to lose a lot of albumin. And these conditions is like burns. Burns, burns can make you to have this type of thing. That is when there is increased service of the body is exposed. Another one is enteropathies. Another one is enteropathies. 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 A good example is people who have hypersensitivity, like people who have gluten, gluten sensitivity. Gluten is a certain protein which is found in wheat, and also some people can have a problem with it, that they have gluten sensitivity, so that they have don't get a proper absorption in the body. This one is called enteropathies. Another example is diseases like Crohn's disease. Crohn's disease is also an example of enteropathies, which can because of loss of body services. Another one is ulcerative colitis. Another condition is ulcerative colitis. Ulcerative colitis is also another very common cause disease. Another one is Wimpo, Wimpo disease. Another one is Wimpo disease. Another one is Wimpo disease. All these ones are evident of poor inadequate absorption in the intestinal, meaning that the intestine is not absorbing albumin or rather protein. That is how we call it. Now it comes that as a loss of our body services. So other cases is like when somebody has a fistula in the GIT, fistula, gastrointestinal fistula, either in the fistula or in the intestinal or in lymphatic system. You can have a fistula which can make you lose a lot of albumin in the body. And that means in this case now, if it is lost in a fistula or in a fistula in the intestinal or in the blood system, in the lymphatic system, that means the circulating amount of albumin is not sufficient. Also, in other cases like hemorrhage, that is related to loss of fluid. This is also another example of causing low albumin in the body in terms of increase over body loss over body services. Other cases is like renal diseases like renal tubular diseases. Uh, there is no reabsorption of albumin in the tuberose. That means now you are using of what you are using, releasing a lot of albumin, and then it appears in the body in tubular diseases. That is another cases. Then another one is preeclampsia, and also eclampsia. And also preeclampsia is another common one where there is excessive loss of albumin in the urine. Also, cases of rapid hydration, cases of rapid hydration. If somebody is given excessive fluid, also can result to what? Dilution. This one can result to hemodilution, can result to hemodilution. And that is also another example. So this is also another example of where we lose above on body services. So those are cases where we have a loss of these increased body loss. One that is increased loss on body services, like in burns, in enteropathies, like when somebody has gluten sensitivity, Crohn's disease, ulcerative colitis, impulse disease, or fistula, intestinal, lymphatic, or hemorrhage, renal diseases, like tubular diseases, preeclampsia, eclampsia. There is excessive loss, and also in rapid hydration, which result to hemodilution. Also, there is now let us look to another cause of what? Another cause of albumin in the body, and this is now what is called excessive catabolism. Excessive catabolism. Excessive catabolism. In excessive catabolism, you will see how people get this type of that is there is excessive consumption. Metabolism, there is excessive metabolism of protein as a source of energy, and this one is very common in the conditions like Cushing's disease. Cushing's disease disease is one of it. Cushing's disease is an example of it. Another one is thyroid diseases. Thyroid diseases. Thyroid diseases also can cause this type of problem. Thyroid diseases where there is excessive production. In thyroid diseases, there is excess production of thyroid hormone binding albumin. The albumin which binds the thyroid hormones is produced in excess. That means the circulating albumin in the body is reduced. So those are excessive in catabolism. Also, we have cases where there is hypovolemia. That is now another one. Another case where is increased blood volume, increased blood volume, or we can call it hypovolemia, where we have these conditions where there is, like for example, in congestive cardiac failure, in CCF, congestive cardiac failure, there is hypovolemia, which results to what? Evidence of dilution effect. Okay, dilution. You know about hemodilution's effect during CCF. Okay, so there is hypovolemia because of increased blood volume due secondary to CCF, which can cause low albumin in the body. Another one is pregnancy. We say that is pregnancy, like eclampsia again. We have preeclampsia. We have preeclampsia as a what? As a cause of these things uh, of evidence in this one, preeclampsia and eclampsia, and also in pregnancy because of circulation. Because in circulations, the hormone can be circulating in the fetus, can also and also in the placenta, and this one is resulting to error albumin because the mother is sharing the albumin in the placenta and also the fetus, meaning the albumin in the body will come down. So basically, those are one of the few things. Now, let us see interfering factors. There is those we call interfering factors in albumin, factors in albumin, interfering factors in albumin. Okay, like there is drugs. Which drugs can increase the amount of albumin in the body? Drugs which increases albumin in the body. mm, Albumin in the body are what? What are these drugs which can make you to have excess albumin in your body? Example is carbamazepine, carbamazepine is an example. Another one is diuretics like furosemide. Furosemide is another one. It's a diuretic. Furosemide, and also pentobarbital. Pentobarbital is also another drug which can increase the amount of albumin, and also prednisolone. And also prednisolone can make you have excess albumin in your body. Okay, so now let us look the drugs which reduce. Let us look the drugs which reduce albumin in the body. Okay, we have the drugs. We have seen the drugs which increases albumin in the body. We have seen prednisolone, we have seen furosemide, we have seen pentobarbital, and also we have seen carbamazepine as examples of drugs which causes increased amount of albumin in the body. Now, in this case, now let us see the drugs which causes low albumin in the body. One of the common drugs we have in our setup is our most common drug, like these acetaminophen painkillers. We use most of them. Acetaminophen poisoning. Okay, for example, you take a lot of brufen. You take a lot of paracetamol, excess paracetamol in the body. Okay, you take a lot of paracetamol in the body can make you have low albumin. In acetaminophen poisoning is also one of this type of problem. Another type of drug is called amiodarone. Okay, it's called amiodarone drug. Drug is one of them. Amiodarone drug is one. Another cause of these drugs is things like brufen, things like estrogen, estrogen also can cause a reduced amount of operon. Also, things like dextran. Dextran is a plasma expander, can cause reduced. Also, there is interleukin 2 can cause also low albumin in the body. Things like contraceptives, contraceptives can also cause that one, and also Phenytoin. Phenytoin can cause that one, and also prednisolone in other cases. You can see that prednisolone can cause high and also can cause low. Okay, prednisolone also can cause low, and also another drug used in epilepsy called another drug called valproic. Okay, valproic acid is another one which causes this one, and also aspa also another thing. Poisoning is an enzyme. It's called It's called asparaginase. It's also called asparaginase. Is also things which can cause low albumin in our body. And I think in summary, we have seen things. We have seen the total discussion about albumin into this, and we have in summary we have talked about albumin, the reason why it is higher in the body because of transportation and also maintaining oncotic pressure. We have seen that albumin is synthesized in the liver, and we have seen that other things which can cause somebody to have less albumin, like inadequate intake, and also we have seen that calculation of albumin is very important in chronicity, where you calculate the albumin, you see that the total protein minus globulin, you get the albumin, then you divide with the total protein versus the albumin, you get the answer. Then we have seen that you should take specimen of albumin when the patient is spine position, because a patient who is standing upright, the albumin may be increased and they may give you false excessive albumin. So we have seen that the indications at what point should we calculate albumin protein ratio is in patients who have chronic diseases, liver disease, and also geriatric patients who are hospitalized for purpose of nutritional assessment. Uh, we have also seen for purpose of diagnosis like hyperinfusion of albumin, decreased intravascular cases, and also we have seen cases where there is decrease in the amount of globulin, like insufficient intake, malnutrition, and also genetically determined things. And also you have seen conditions which are chronic or inflammation conditions which causes reduced albumin in the body, like parasitic skin diseases, rheumatic diseases, neoplasms, bacterial infections, all those times we have seen them. Then we have also seen the cases where we have loss of low albumin in the body because of increased loss of body surfaces, for example, in enteropathies, in burns, in fistula, kidney disease, preeclampsia, and even in rapid hydration. Also, we have seen that cases like increased catabolism, like Cushing's and thyroid diseases, can make you have low albumin. Also, we have seen that cases where there is hypovolemia, secondary things like CCF, preeclampsia, and also pregnancy can cause you to have a low albumin in the body. We have seen the drugs which make interfere with the albumin levels in the body. We have seen the drugs which make high albumin in the body. For example, carbamazepine. We have seen furosemide and pentobarbital and prednisone. We have seen the drugs which causes reduced albumin in the body, like acetaminophen poisoning, brufen, estrogen, interleukin, dextran, contraceptives, phenytoin, valproic acid, and also prednisone again. And that is the summary of today's lecture. Thank you very much for listening to us. Thank you.